Welcome to the international press briefing regarding outbreaks and mutations of Danish mink farms. As announced yesterday, a unique mutation of COVID has been found on mink farms in human beings living primarily in the area around the affected farms. The Danish government regards this as a very concerning development, and we are treating it with the utmost seriousness. We are taking all necessary and appropriate actions, including the culling of all remaining mink in Denmark. Let me also clarify that outbreaks among mink is not a new phenomenon, as we have seen it in several countries. Since June 2020, COVID-19 has been seen in mink. As the virus transmission between mink and humans, as of yesterday, 216 mink farms are infected. We have indications that this unique mutation have a reduced response to antibodies, which can ultimately affect the efficiency of potential vaccines. Currently, further tests on this matter are being concluded and conducted. Denmark has informed the ECDC, the World Health Organization, and the European Commission of the findings, and we will provide full transparency. We are taking resolute measures to address the outbreak of the mutated virus. All remaining mink will now be culled, including non-infected and otherwise healthy mink. We have begun intensified efforts to conclude this operation as swiftly as possible. New wide-ranging restrictions will be implemented for the population in the 7 affected municipalities. This includes, but not restricted to, the COVID-19 testing capacity in the affected regions will be reinforced, and all inhabitants are encouraged to undergo testing. Movements between the municipalities will be strongly discouraged unless it is required for essential purposes, critical functions. All public and private workplaces are strongly encouraged to restrict the physical presence at the workplace to essential functions only. Restaurants, bars, cafes will be closed with the exception of takeaway. All indoor and outdoor cultural institutions and venues used for various sports will be closed for public access. All inhabitants are encouraged to minimize social contacts. The current public ban on gathering of more than 10 people will be expanded to areas currently exempted. These are just few of the steps we are taking. I cannot underline enough how seriously the Danish government takes this situation. The Danish government has, for the moment, the global pandemic reached Denmark, chosen to act fast, decisively, and with clear commitment that we would rather go a step too far than take a step too little to combat COVID-19. This is also the reason why we have chosen to take extensive and comprehensive measures in the current situation. Culling of 17 million mink, effectively shutting down the entire industry for now in Denmark. Extensive local restrictions in the affected areas, large-scale testing of the population in the affected areas. This is not a decision that has been taken lightly, but it is a necessary precaution. We are fully committed to ensure that the current situation is dealt with swiftly, effectively, and decisively. I will now give the floor to my colleagues here at the table. First, I will start with Søren Brostrøm from the Danish Health Authority. Søren, the floor is yours.
Thank you, Minister. The mink industry is proportionally very large in our small country. We have been very concerned with the rapidly evolving spread of COVID-19 among minks in Denmark, and also the rapidly evolving transmission of COVID-19 virus from humans to mink and from minks to humans. And this has been rapidly evolving, and the new mutations that have been found is certainly just adding to that concern. Therefore, the very huge decision by our government of culling all the live mink in Denmark and effectively putting a halt to mink industry is, of course, not a decision taken lightly. But in our view as a healthcare authority, it is a timely and necessary measure for us to retain control of our epidemic in Denmark. Locally, in the areas hit worst in our country by mink-to-human transmission of virus, but also nationally for retaining our control of the epidemic. But you should also see this measure as our contribution to retaining global control of the pandemic. Just briefly to explain how we have controlled and retained control of the epidemic in our country. We were hit by COVID-19 in the last week of February, the first week of March, and it rapidly evolved as in many countries across Europe. Many measures were taken in our country in the second and third week of March, and we quickly saw effect, and already by the 1st of April, our first wave had mitigated, and from around the beginning of May, and for the next couple of months over the summer, we had a low level of community transmission in this country. Around the beginning of September, we saw a re-emergence of COVID-19 transmission in our country, and this has increased also as we moved into the colder months in our society, as well as reopening of society, which we were one of the first countries already around the middle of April to reopen schools and kindergartens, etc., and we have managed to keep a very open society and are still doing it. And we are currently retaining control of our epidemic in this country with a reproductive numbers just slightly above 1, and generally with the measures that are constantly being adjusted. Currently we are at a maximum of 10 for public gatherings, bars and restaurants, etc., are closing at 10 p.m. And we have also gradually increased the measures of using face masks, etc. That has proven to be effective. We have found in this country an effective balance between keeping an open society while also at the same time retaining control of the epidemic. We currently have two challenges. One challenge is certainly a large reservoir of virus in mink and the mink-to-human transmission. And we also have a second challenge in a number of areas of our countries where we are seeing rapidly evolving transmission, including in some western parts of Copenhagen with a large immigrant population. But we've also proven in this country that we have a very large testing capacity. We have a very good monitoring system. We are able to work very closely among national and local authorities to implement measures that will make us able to retain control of our epidemic, and I'm very optimistic that we can do this, also looking forward, also taking into account the new situation with the mink. Thank you very much.
Thank you so much to Søren from the Danish Health Authority. Now I would pass the floor to Tyra Krause from the Serum Institute, please.
Thank you. As Søren mentioned, in Denmark we have a very high testing rate, I think one of the highest in Europe. And we also do a lot of whole genomic sequencing as part of our surveillance program. We do whole genomic sequencing of around 14% of all the positive samples in Denmark. Since we have seen the outbreaks of coronavirus in mink farms, we have also seen transmission to people working in mink farms and also transmission to the community. From June and until now, we have identified 5 different variants with mink-specific changes in the viruses. And one of these variants that we call cluster 5 have 4 different changes in the spike protein of the virus. The spike protein is quite important because this is the protein that is used for entering the cells. And many of the vaccines that are currently under development are directed towards the spike protein. This week, we got the lab results from some experiments where this virus has been grown in cells, and we have added antibodies from patients that have previously recovered from a COVID-19 infection. And what we could see was that this variant showed less sensitivity to these neutralizing antibodies from recovered patients. This is a concern because this may mean that in the future that some of the COVID-19 spike-directed vaccine may be less effective against these variants of the virus. This is not certain. We still need to do ongoing tests and scientific research, but it's a concern. We got this result this Monday, and Tuesday we made a new risk assessment together with the National Health Authority, where we assessed that there was a considerable public health risk associated with having mink breeding ongoing during a pandemic. And there was also a risk that a potential risk that these changes that we have seen may affect the effectiveness of COVID-19 vaccines against this new variant. On the 3rd, we sent this new risk assessment to the National Health Authority, the Ministry of Health, and on the 4th, we shared the information with the early warning response system underneath the European Commission, and we also shared the information with WHO as part of our obligations within the international health regulations. Yesterday we had a telephone conference with ECDC and WHO where we shared all the results, and today we have also shared the whole sequence in these warning networks, and we have also uploaded all the different sequences of these viruses in the National Genomic Database called GIS8. So, yeah, that was a status from our institute.
Thank you so much, Tyra. And now I will give the floor to Nikolas Hove, Head of Crisis Management, Danish Veterinary and Food Administration, please. It is on.
Good. Thank you, Minister. It is not a pleasant task we face. We have, as you heard, almost 17 million minks in Denmark. At the moment, we have been culling mink from the start of October. Doing this, we ensure that the culling is done under the best animal welfare conditions that we can manage. Because it is such a huge task, we are cooperating together with the National Police, with the Danish Emergency Management Agency, with Defense, with environment and nature agencies, along with colleagues from other ministry authorities. The overall task is coordinated by the National Operative Crisis Management Staff, and that is where I am going just after this meeting. The risk assessment that was changed earlier this week meant that the risk management that we do regarding mink has changed significantly. We have a huge task that is that we try to finish within only a few weeks. The culling of mink is done in 3 ways. Minks are normally their fur is taken off at these weeks we are in now. This is also one of the things that is going on at the moment. On top of that, some of the mink farmers are also culling mink on behalf of the government, and then the government ourselves, we are culling milk at several mink farms at the moment. We have been culling minks for several weeks. At the moment, we have around 216 mink farms that have been contaminated with COVID-19. We have a strategy to curl mink within a zone of 7.8 kilometers from a contaminated mink farm. This equals around 300 mink farms in Denmark. In total, we have almost curled 200 of these mink farms either contaminated with COVID-19 or in a zone around a contaminated mink farm. It's still a huge task to do. It's not pleasant. We do it in a manner that is with animal welfare in mind. And we are trying to have this done within a very short time. So that was it. Thank you.
Thank you, Nikolas. So now what I would do is open up for questions. Now we'll answer the questions of the general political aspects of the situation, the current situation, and the general approach of the Danish government to the current situation. And our three experts will then be able to answer the more technical and health-related questions and issues. So now I open up the floor. And please identify yourself, and the questions is in English, please.
Nadia Kronborg, Danish Broadcasting Corporation. World Health Organization says that they don't have any evidence that this mutated version will affect the vaccine. So are we overreacting by shutting down an entire part of Denmark?
I will pass the question to the, I think it will be Tyra that will answer, please.
So we definitely need to do more studies on this specific variant and its effect or possible effect on future vaccines, but it takes a long time to do these kind of studies. So in order to act in time, we felt that it was important to share this information already now and react on the information, even though we don't have complete evidence at this time.
And I can add that, as Tyra also said, we received Tuesday the updated risk assessment from SSI, where it stated that it was a considerable public health risk issue, and that's what we are acting on. Any more comments? No? Then we take the second question, please.
Yes, and we were told that we haven't found any people with this cluster 5 version since September. So is it necessary to ask people to stay at home, close schools, public transport, if we at this point have no one infected with this cluster 5 virus?
That is for Søren Brostrøm, Danish Health Authority, please.
This risk assessment regarding the mutations is adding on top of a strong concern regarding, as I told in my introduction, regarding the large reservoir of COVID-19 infection in the mink industry and the risk from having a mink-to-human transmission. The virus mutations is adding to that concern, but that concern was already huge. We have a very large community transmission among people in the 7 local communities where we introduced a number of new restrictions. That is very concerning. What is one part of the restrictions and measures that we have introduced is also an extremely ambitious testing strategy, where we're basically asking the population of these 7 local communities to be tested within the next couple of weeks. We're doing this with an abundance of caution. We will get more knowledge about the extent of human transmission in those communities, the extent of mink-related virus in the human population, and also we will sequence all the positive results, and we'll get to know in the next couple of weeks much more about the extent of eventual mutated virus. And in a couple of weeks we'll know more, and then we can adjust the measures as we see appropriate.
Thank you. Next question. Yes, please.
Morten Butler, Bloomberg News. We would like to know a little bit more about the numbers coming out today from the SSI regarding the various mink mutations. As I understand it, 5 different, as you pointed out, 5 different mutations. More than 200 people have some version, one of these variations. How likely is it that that number is going to just keep increasing over the next few weeks, as was mentioned before? And how do you see this development?
Yes, I forgot to give you the numbers, but it's correct. We have identified 214 patients with these specific mink variants and 12 people with this especially concerning mink variant cluster 5. We don't know how many has cluster 5 at this time, but we'll find out when we start to sequence all the positive samples from the northern region of Jutland, because the far majority is from that area. What I think is we will see an increase in the coming weeks, and maybe also outside region Jutland, in the middle part of Jutland, because we also have seen infected farms in these areas. So we may likely see more transmission of these viruses also in other areas. But there's no doubt at this time we have the main problem is in the northern part of Jutland.
And a follow-up question, perhaps either to the minister or to the SSI. Yesterday, the head of the SSI said that WHO had voiced, I think he said they were worried about the situation and monitoring the situation closely. Today we know that the WHO says they're not really that concerned at the moment, as my colleague said before, also saying that we're far away from making any kind of assessment on this yet. Much more studies are needed. What is the sort of the thoughts about potentially creating some kind of global panic on this issue if it turns out to be completely unnecessary?
Well, Tyra can answer the technical part.
Yeah, that's always a balance of risk, and in this case, I think it's better instead of waiting. You really need, when you have works with the epidemics, you need to act in time, and instead of waiting until you get all the evidence, then it might be too late. So you need to act in time, and now when we got this concern, you need to start to stop transmission, and so I think it's you need to react quickly and not just wait for evidence. But of course, on the side, we also have to do all these additional studies to find out whether this is a real concern.
And we, as I said in my introduction, we are in full transparency. We are working and of course provided the information to the World Health Organization, to ECDC, to the European Commission, and thereby giving all the data we can and exploring the issue in depth. It's very important. But this government will, on a recommendation of health authorities and research, we will act in time to ensure that we will take the accurate actions against the COVID spreading and also this particular mutation, which is a great concern, and therefore we are reacting precautionary to be sure that it will not spread too much.
If I might add just one comment on vaccine efficacy, which is also certainly being raised here. We are acting, as the minister said, with an abundance of caution in a timely fashion because we have this concern about what it could mean for immunity. But it's also very important to say that the vaccines being developed now in large-scale randomized controlled trials, very well documented, that we expect to have very soon documented, approved, and able for use. They will certainly be effective. They will be documented effective. We will, of course, share our knowledge. We will do extreme large testing to prove or disprove how large a problem this is in our population. But it should not mean that people suddenly start saying the vaccines will not work. When they come, they will be very well documented. We will look at the documentation. We will not be using vaccines unless they are documented to a very high level of proof that the European medical authorities will accept as proof of efficacy.
Just a tiny little follow-up just about the culling of the mink. It was mentioned that it would be fairly soon. Can you maybe elaborate a little bit on whether we're talking days, weeks, months?
Thank you for the good question. We are talking right now about having the entire population of mink in Denmark culled within only a few weeks.
Thank you.
Okay. Yes, please. Next.
Okay, two questions. The first question will come on Danish TV2. The first question is to Søren Brostrøm and to you as well, Tyra. I would like to ask if you have any kind of concern about an over-deathly toll among these newly found variations of the coronavirus. And the second question is for you, Minister, and that's a question about what kind of reaction you get in the Foreign Minister from our export markets. This is a 5 billion Danish kroner business in 2019, but some of the export market might be concerned and think, well, how about pigs? How about everything else that we export from animals? Could you give us an overview about what's coming in the ministerium at this point? Thank you.
Well, if I can start and then leave the floor to Tyra and Søren after. First of all, what we've done, as we said, swiftly in this week when we got the new risk assessment in the government. We have shared all the information with World Health Organization, ECDC, European Commission, others. And the ministry, we have instructed all of our embassies around the world to provide information to the countries there. And I've personally also talked to several foreign ministers and informed them about the actions we are taking in Denmark. We are taking this situation very seriously. We are, and we always want to be before the curve when it comes to the combating COVID-19 and also the specific risk of a mutated virus and the implications that mutated virus creates for us. So we are reaching out and we will of course protect and ensure that the good reputation of Denmark, very high standards for health and also animal security is there in Denmark, and that's also why we act so swiftly. But I think first Tyra and then Søren after.
If you asked about the seriousness of this variant compared to the normal variants, we have no data to indicate that it should be more serious or more transmissible than the normal viruses. So there's no reason to be concerned in Northern Jutland with regards to these variants. There's no increased individual risk associated with infection with these.
Good. I think that was all for now. Thank you so much for coming, and thank you.